When I came out of secondary care, it felt rather isolating, being back in the real world.
Everyone around you thinks, yeah, she's not got the disease anymore, she's going to be fine, everything's going to be okay. And that's when the slump comes, because you're not going into hospital anymore, so you're not able to talk to anybody.
You really suddenly feel alone, and primary care seemed rather distant.
What hasn't happened for me is, how do you feel psychologically? People kind of take for granted, he's a strong lad, done this, it was hard. I think I had 36 treatments for the radiotherapy, 3 chemotherapy, and I thought, well, actually, I kind of need some help myself.
A cancer care review in primary care is essentially a conversation between an individual, their GP, and or their nurse. It's about seamless care from secondary to primary to the community.
It offers patients a personalised and holistic approach to identifying the unmet needs and framing those needs as a clinician in primary care.
So looking after them in that full context of their other conditions, which may be hypertension, it might be diabetes, is definitely the way that one should be looking at it. Cancer care review has been routinely offered by primary care at 6 months post the cancer diagnosis.
Saying that, there are other times of need for that patient along their journey, and so there might be other opportunities either that come about quite naturally, for instance, alongside other reviews that they're having in primary care, where you would incorporate components of the cancer care review.
Practices themselves could do a number of things, such as identifying those patients who have been newly diagnosed with cancer, sending them out letters to invite them for cancer care reviews.
I think the most important thing to remember is actually that we should be proactive. Patients have a lot on their plate. They also may not realise the amount of support they can get from primary care.
We found that supplementing that letter with some sort of questionnaire, that could be questions around how they're feeling, what issues do they want to bring up in practice, does help with the fuller discussion of the cancer care review. The purpose of the work that we've been doing in the Alliance has been to empower patients to understand the reviews. So if the practice hasn't done it, or it hasn't been done in the time that the patient has recognised that it needs to be done, then the patient is absolutely in their rights to request one too. Communication and sharing of information is so vital, particularly when patients are moving from different services or different systems.
So often if holistic needs assessments have been done within the hospital or treatment summaries have been written, getting those to the primary care team helps to make sure we incorporate all the different aspects, for instance, the consequences of some of the treatments, or even just highlighting some of the needs that have already been identified.
So I can see on tamoxifen, and that's something that I need to provide you with prescriptions for going forward. But you've also mentioned here about discussing tamoxifen a bit more and the side effects.
Maybe it's just normal. I think if you go through...
As needs vary, the timing of another cancer care review might vary. It's not necessarily prescriptive after that, and there's an opportunity to do cancer care review components as part of any long-term condition review, and primary care is a perfect setting for that.